Hi, this is Landon Bryce from thoughtcast.com. I'd like to talk with you about a formula for deciding how outraged to be about a particular autism treatment. I've decided that I need this formula because sometimes I write a lot about autism and I write a lot about therapies for autism. That's because I myself am autistic, and because I taught for 20 years, I have a master's of science in education. I feel like I have a background for evaluating and understanding treatments that, frankly, most people who discuss these things do not have. They lack either the personal background and investment, or they lack the professional knowledge, or they lack the professional expertise. So, some people become very critical of me for acting like I can talk for everybody. I don't want to speak for anyone other than myself. But I think my point of view is well-informed and intelligent. And I have no problem putting it forward as nothing other than my point of view. That's all it is. So this is how outraged I am going to be about particular autism treatments. One of the things I'm going to factor in is how aversive the treatment is. What that means, I know that you may not know that word, but aversiveness basic means is how unpleasant it is to go through it. So, if it's torturously unpleasant, if it involves electrical shocks, if it makes you feel terrible, if it's insulting, you need to factor in not what it is like for the person who experiences the treatment to go through it. You also need to factor in the damage that is done by the treatment, both to the person who suffers it and to people around them. And this is separate from the aversiveness of going through the immediate therapy, right? It's possible that a therapy may be extremely unpleasant at the moment, but not have any damaging long-term effects. And it's also possible that a therapy can be not at all unpleasant to go through and can have tremendous long-term damage. What kind of damage am I talking about? I'm talking about psychological damage. I'm also talking about physical damage. And damage concerning status, not just your own status in your head, but also your actual status in society. And finally, I think you need to divide those things by the effectiveness of the treatment. If a treatment is unpleasant to go through and maybe causes some damage, but also causes undeniable benefits in some ways, then I think you need to factor that in, right? When you're deciding if you're going to be angry about something and write about it in a terribly upset way. And then I think you also need to multiply that by the number of people who are given this therapy. There's no point in, I could invent a treatment where I think I can cure autism by jabbing people with steel picks in their armpits for 5 hours a day, okay? And that would be a very aversive treatment, okay? It wouldn't be very unpleasant to go through. It would cause some damage, right? You probably have some long-term damage from being poked in your armpit with steel spikes, I imagine. And it would be completely ineffective. However, I probably couldn't get anybody to do that, right? So the number of people who would be affected by it would be zero. We have a tendency sometimes in modern day culture to be very outraged by outrageous ideas and not pay very much attention to the fact that there might be 4 people actually using them. And I think The treatment that I am most concerned about, frankly, is the use of medication, particularly very, very strong antipsychotic medication, particularly Risperdal or risperidone, particularly with children. I think we should all be tremendously outraged by that, by the commonness of that treatment, by the frequency with which we are doling out extremely powerful psychoactive drugs to adults, and more particularly to children, and more particularly when those drugs are very damaging, are very aversive to go through, and are not effective for the things for which they are most frequently prescribed. I think there are legitimate reasons to be concerned about a treatment such as applied behavior analysis, but I think it can be done in ways which will minimize the aversiveness and therefore do less damage. And it is, thus far, the most effective treatment available. And then we get to the topic of our next video, facilitated communication. I have a fairly long-standing disagreement with a very prominent autism blogger named Kim Wombles. And part of that disagreement stems from the extent of her outrage over the treatment of facilitated communication. So I'm going to talk about that, but I'm going to do it in a separate video so that if you're not particularly interested in that particular treatment, you don't need to watch it. But I would ask you, when you're deciding, how mad to be about something that's happening to an autistic person in terms of treatment, think about, how unpleasant is it to go through, how much damage is done, how effective is it, and how many people actually experience it. So, thanks. Have a great day.